Tennesseans without insurance are getting sicker. With no coverage, many residents are too scared to go to the doctor until there's an emergency. And now new research suggests that simply expanding Medicaid in Tennessee could help. Here's Chris Conti, new at 6.
Sitting in the shadow of the Capitol today, Joanne Sonnenblick and her husband Stephen were contemplating their state of affairs.
There are people out there that need that help. You should give it to them.
She is talking about state lawmakers who, over the last decade, have continued to not pass any kind of Medicaid expansion. It means there are 380,000 Tennesseans without insurance.
It's just scary. It's a scary situation.
Joanne was among their ranks when she broke her hip last year. Her medical debt is now well over $20,000.
I thought I was going to lose everything. Everything.
The impacts of not expanding Medicaid and having hundreds of thousands without insurance have long just been hypotheticals.
In the colors is the uninsurance rate.
But now Dr. John Graves at Vanderbilt can quantify the impact of not expanding Medicaid.
I think the evidence is becoming clear that health insurance plays a role in shaping people's health.
In a study released recently, Dr. Graves and his team's data showed that residents in states where Medicaid has been expanded are overall healthier.
What we found is that Medicaid, at least in our sample, keeps people from having a precipitous decline in their health.
Those stuck without coverage know full well the impact it has. For years, Joanne, a diabetic, simply avoided going to the doctor.
To me, something needs to be done for those who can't help themselves.
It's up to lawmakers, though, to decide what the future of Medicaid will look like. Chris Conti, News Channel 5.
And Chris has spent the last year reporting on medical debt and the rural health care crisis. If you have a story you think Chris should tell, he wants to hear from you.